All right, want to bring you this health alert now. Health officials are confirming 2 new cases of measles in the state today. That brings the total up to 5. ABC4's Kate Gardner breaks down what the state is doing to contain the situation and what you should do if you believe you've been exposed to it.
All 5 who are infected were unvaccinated. The state epidemiologist says that 90% of Utahns are vaccinated, but these cases are a cause for concern because infants are susceptible and more likely to become severely ill.
We have found that 2 of the people who are infected have had to go to the hospital and stay at least overnight. That is very concerning to us. We certainly want to have as minimal infections as we can here in Utah and as mild. So to know that 2 out of 5 people had to go to the hospital for their measles infections is quite concerning to us.
State epidemiologist Dr. Leisha Nolan says they were quickly released from the hospital.
But they were still significantly ill, and they did need that hospital attention. So it is concerning that this is happening when we only have identified 5 people who have measles.
She says 2 of the 5 are pregnant women.
And people who are pregnant, if they get measles, they're much more likely to get severe infections, much more likely to go to the hospital. And unfortunately, they're also much more likely to have premature birth or even lose the baby.
She encourages those who are considering having a baby to check their vaccination status because you can't get vaccinated while pregnant, and babies cannot be vaccinated until they are 1.
Having everybody vaccinated around a baby is the best way to protect a baby.
For those who may be exposed to measles, Dr. Nolan says the symptoms start off like a cold. The giveaway? A rash that usually starts on the head.
We really encourage them to call into their clinic, to talk to their doctor, let them know what's going on. We really encourage them, if they do need medical care, to call ahead. We don't want someone with measles to walk into a waiting room and expose everybody else in the waiting room to measles.
In case this does happen, Dr. Nolan says they've been working with healthcare partners for months.
It's because we were expecting this to arrive. And so we have worked with them to identify procedures so that they don't have people with measles-like symptoms sit in the waiting room.
The state is now going to be updating online information about current infections every weekday. For more information about that, visit abc4.com. Reporting from Salt Lake City, Kate Gardner, ABC4 News.